Hi everybody, my name is Jenny Niemeyer Hultstrand. I am a Swedish medical doctor and I have a PhD within sexual and reproductive health. And I was honored by the invitation by Sanyo Sisters podcast to give you a brief presentation of my project that I conducted in Eswatini in Southern Africa. I will start screen sharing with you so that you can see my presentation. Just a second. Okay, so the topic of today is using the Reproductive Life Plan in Eswatini together with mentor mothers. And I performed this study together with a local non-governmental organization in Eswatini called Sipilile Maternal and Child Health. Let me see where I can see the mouse. Here it is. Okay. So Eswatini is a small kingdom in sub-Saharan Africa. It has among the highest incidence of unplanned and unwanted pregnancies in Africa. And many Swati women suffer from poor preconception health, meaning they are not well prepared for a pregnancy. For example, a majority is overweight or obese, and 41% of women of reproductive age are HIV positive. And many are in need of optimized treatment in order to prevent transmission of HIV from mother to children. This picture shows where Eswatini is located and also a typical picture from one of the settings where I worked. So this project leaped from a study that we conducted in 2016, where we identified that 70% of the pregnancies in this population were unplanned. 70%. And it seemed that most of these pregnancies were also unwanted. We also performed a qualitative study where we identified several health and social consequences of these pregnancies, affecting both women, children, and the families. And one of the mentor mothers, so first I may introduce a mentor mother, is a woman that is recruited from the neighborhoods and educated about basic health issues. She is then walking from house to house and provide home visits to other women in her own neighborhood area. And she helps women and children by health examinations, by health discussions, and also by referrals to hospitals if needed. So a mentor mother is a peer supporter. And one of these mentor mothers, Constance, she drew this picture to describe the situation. And she explains the picture as this. A mother has 2 children in 3 years, and now she's pregnant with a 3rd child unplanned. She needs counseling and advice from her mentor mother. And I think this picture describes the situation that we see a lot in the community, that it is poor spacing between births, many children are neglected, and there's a stress in the family on how to best provide for the babies and for the children. So the aim with this study was to see if the Reproductive Life Plan, which is a screening tool for health workers, if this screening tool could be helpful for the mentor mothers. This screening tool has formerly been used in several high-income settings, including in the US and in Sweden as well. But it has never been tested in a low-income setting before, or with mentor mothers or other community health workers. And the aim with the RLP is to help individuals reflect on the reproductive goals and also to reach the reproductive goals. And this could be to not have any children at all, or to have 1 or 2 or 3 or how many children as they like. The aim is also to reduce the number of unplanned pregnancies or unwanted pregnancies and to improve preconception health. And it's quite simple or basic, this tool. It's very patient-centered, and it starts with the health worker asking the client, do you want to have any more children in the future? And depending on the client's answer, she can either receive preconception care, like advice on how to best prepare for a pregnancy, or contraception care, ways to prevent an unwanted pregnancy. So this study started in January 2018, where 29 mentor mothers were trained in using this RLP. They were then instructed to use it with their clients for 4 months, and then I came back and evaluated it in May 2018. And we used both qualitative and quantitative measures to do so, but it was mostly based on focus group discussions. So these two pictures shows, first we have a picture from one of the training sessions in which we went through a lot about preconception health and also contraception. And the second picture is from one of the role plays that we conducted, and it shows how one of the mentor mothers explains the procedure of inserting a contraceptive implant into the upper arm of her client that has recently given birth. The findings from this study was published last year, and it's available in open access online. So you should be able to just Google the title and you will find it. I will present the results quite briefly. It's just a crash course. But what was evident was that the mentor mothers said that using the RLP led to progress in their communities, as it led to increased contraceptive use. They also thought that the quality of contraceptive counseling increased or improved, as well as their confidence when having these discussions. Mentor mother Tandiva said, "It has had a great impact on our clients. I once had a client whereby maybe yearly gave birth, but now she's on implant, and even her husband is saying he appreciates." Another mentor mother reflected upon how this way of working was different from before and how it made her feel more confident. What I see on these questions is that there are things that are opening her mind and even my mind. When I ask the question, "Do you want to have any more children?" I listen to the answer and then I can tell her, "You can do this." Sometimes I didn't know what to say, but now I know. The mentor mothers perceive their role as peer supporters as key in successful RLP counseling, because they often had a long and trustful relationship with their clients, and this made it easy to discuss sensitive subjects. And most of the mentor mothers, they are women from the same context, so most of them had also had unplanned pregnancies themselves, and they understood the struggle that many of these women face. The mentor mothers were generally strongly dedicated to use the RLP, and this is how one of the mentor mothers reflected upon this. "If you don't introduce that, you're actually bringing poverty yourself, because you've got the information, but you are keeping it." Finally, there were factors in the context that we could not control that affected this counseling quite a lot. For example, partners sometimes use reproduction consciously as a way of controlling one another, but many times reproduction was neither conscious nor a possible decision to make. And men also had limited power in this, as they were seldom involved in family planning. And women's reproductive health and rights and their ability to achieve their reproductive goals were often hampered by, for example, legislations that prevent them from accessing sterilization. And also the clinics offer only a few contraceptive methods. So there were many structural barriers for achieving reproductive goals as well. This is how Nolwasi reflected upon this. "The girlfriend loves the boy and she feels like, I will catch him by giving him the baby. So they just neglect themselves, the girls. Even the boy sometimes feels that if the woman have more babies, she cannot look for other men because she will be busy with the children." So this quote just illustrates that it's not about what women or individuals want. There are other factors that affect reproductive decision-making quite a lot in this context. The conclusions from this study are that using the RLP was a feasible way of improving contraceptive counseling in this setting. And dementia mothers' role as peer supporters was key in successful counseling. And I still have regular contact, although the project is finished, I have regular contact with dementia mothers on WhatsApp, and we send updates and questions and such. And it's a really good way of communicating, as most women and most people own at least a basic mobile device. Then this mobile technology is a good way of communicating, really. Thank you so much for listening. Please email me if you have any questions. If you like to access my thesis where I discuss unplanned pregnancies in Eswatini in more detail, you can find it at this link, or I think you can also find it by just Google my name. Thank you so much and take care. Bye-bye.